and we appreciate that cancer itself is a difficult diagnosis. It's a frightening disease. Anyone who would be handed out this diagnosis would naturally have many questions, a lot of stress related to treatment, the diagnosis itself, staging, what to expect out of that treatment. Obviously, everybody wants to get cured, and therefore, the type of treatment is one of the major questions up on the list of every patient and every family. Not only the treatment, it's the entire gamut of issues related to the treatment and the other subjects surrounding the treatment, like diet, exercise, precautions, do's and don'ts, what would happen once the treatment is finished, how the follow-up would happen, how frequently a patient would have to come back to the hospital, what investigations would be done. I think these are all questions which crop up in one's mind. Let's go one by one. First and foremost is the diagnosis. Friends, what we need to appreciate is that cancer is not a single disease. Cancer is a group of diseases, and an oncologist like me deals with about 40 to 50 common cancers in the clinic on a day-to-day basis. Not only that, cancer of each organ itself is a group of diseases. For a layperson, lung cancer is one disease, but for a practicing oncologist, it's at least a group of about 10 to 12 sub-diseases, each one being treated differently from the other entity. So therefore, the diagnosis matters, the staging matters. So have a checklist of the points you wish to discuss with the doctor. One, what type of cancer this is, what's the stage, and the stage would dictate what type of treatment would be required. Most of the organ-specific cancers in the early stages are treated with surgery, followed by some sort of maybe chemotherapy and radiation. Therefore, this question is important. What's the stage and what's the treatment which is going to follow? The next question would be the relevant investigations which need to be done to close the staging paradigm and choose the right treatment. In today's time, there is a plethora of tests which a doctor would perform, including a PET scan, a biopsy, and on the biopsy, some special tests which are called as molecular testing, or sometimes called as the special tests, precision oncology tests. So cooperate with the doctor, ask in a more positive manner that what could be done, and where all these tests may be done. No one hospital may have everything under one roof. So therefore, there may be a collaborative effort between many hospitals and many labs around the countryside to close the information on a particular piece of biopsy. So that's important. Now coming to treatment, cancer is generally a multimodality treatment. That's what we call it as. Why? Because more than one specialties are involved. As I said, most of the organ-specific cancers are treated with surgery in earlier stages, and most of the cancers in late stages are treated by a combination of chemotherapy, radiation, targeted therapies, immunotherapies, and so on and so forth. Surgery may still have a role in a small percentage of patients. What do you do and what you don't do during treatment? Be clear with your doctor. The instructions would be linked to the type of treatment, the intensity of the treatment, and the intensity of treatment would lead to an immunosuppression which would be different from patient to patient. So therefore, waiting in the doctor's outside doctor's chambers might lead to discussions, but be very clear that every discussion is not applicable to every patient, because treatment of A individual may be different from B, and therefore the instructions would be different. The dietary instruction could be different, the other instructions could be different. But generally, cancer treatments do lead to some sort of immune suppression. Therefore, staying in a more protected environment, avoiding crowds, avoiding getting infections is imperative. Once a treatment is done, then the follow-up begins, and the follow-up is on a periodic basis, which may be different from cancer to cancer, but generally in the first 1 to 2 years, your doctors would continue to call you back almost all on a 3-monthly basis and then gradually enlarge the follow-up time to 6 monthly and then an annual once a patient has crossed certain milestones. The instructions following treatment completion are also important. Go back to normal life, exercise, eat well, eat a healthy diet, maintain a good body weight, a balance of body weight, go slow on alcohol, no tobacco. I think these are some of the instructions which would be given to most of the patients. Thank you so much.